So it's great. You can diagnose somebody according to these. Had a patient who was, at first I diagnosed her because I was doing all emotional treatments. It was all like based on the emotions and who she was. First diagnosed her as an excessive fire type because she would like come to you and she'd be like, I just did this great performance and it was amazing. Like she was literally a street performer. She did like all these things and was super energetic, super joyful. Seemed like she always wanted to like have a good time. So excess fire type. When you look at treating somebody according to their 5 elements, let's go back to the picture of them. Let's use this one. If you have an excessive fire type, you always treat them based on either their mother or their child. Sorry, if you have an issue with a particular type, with a particular element, you either go to the mother or the child. The way of treating an excessive condition, for instance, an excessive fire type, is you always sedate or calm down the child. And the thinking behind this is there's no way the mother can relax if the child isn't calmed down. Right? If the child is like, rah, there's no way the mother can be calm and you can calm down that excessiveness in them. Does that make sense?
I mean, I heard water theory about like reducing the mother, the womb.
That's for an excessive?
Yeah, excess.
Yeah, that's not how we treat it.
Not how. Or increase the water.
Yeah, so we'll get to that next part. So if there's too much fire, like Benson was referring to, what do you think we'd want to do with the grandmother water? Are we going to want to strengthen the water so it continues to control it? Or are we going to want to calm the water down so it doesn't control it?
Strengthen.
We're going to strengthen it because we want the water element to go over there and control the fire element and get it from being out of control. That's why I love this. It's like I said, it's so poetic.
So when you're treating an excessive, you're calming the child first.
Yes.
And then you're strengthening the grandmother.
Yes.
So you calm and then strengthen.
Calm the child, strengthen the grandmother. Exactly.
Okay. It's not an either or.
Both at the same time. Yes.
Okay.
And it's great because you can do this with acupuncture. So you'd go to the fire element, which is the heart, go to the heart channel, and you'd find the earth point on the channel. There's earth points. There's all of the 5 element points are on that channel. So you'd find the earth point, and then what would you do? You would sedate that point. You'd reduce it, pull energy out of it. By doing that, you're naturally calming down the fire element. And then the other thing you do is you'd go to the water element on that channel, and you would tonify it. You would strengthen it, put chi into it. Via different techniques that you can do with acupuncture, so that it will control the fire element and calm it down.
That's so interesting. So with needles, you can actually calm down an energy and strengthen one.
Yes. There's a lot of different things. We'll go into various techniques. I'll show you techniques when we're in the acupuncture class. Yeah. So that's going to the fire channel. But then you can actually, so that's half of the story. The other half of the story is you'll actually go to the earth channel, because the earth is the child. So you'd find the most earth point on the body, and in this case, because you're trying to sedate fire, you would sedate the earth point. That's the most earth point. So it's the earth point on the earth channel. So see what that means. You're going to go to the affected channel, your main organ or main element that's affected. So for the excessive fire type, I'm going to the heart channel because that's the fire organ. On that channel, I'm going to sedate the child, earth, and I'm going to tonify the grandmother, water. But then I'm going to go to the earth channel itself and sedate the earth point on that channel. Then I'm going to go to the water point on the water channel and tonify that point. Is that clear? I know that's a lot of students have a really hard time grasping this. I tutor this over and over again with students.